So we will go to nursing care to case study 2021. Please don't forget, I have promised to take a session so that we may handle nursing care plan at length. All of this is for your good, and we are doing all this because we love you and we really want that all of you to succeed. And the first thing is for you to, no matter how is you can only succeed when you have a good teacher, when you have a good facilitator. So because there's a part the facilitator is supposed to play, and there's also a part you are supposed to play. You are the one who will go and enter inside the hall and write. I will not be the one to be writing the HMD for you. And so if anything that we are doing, you are not taking it serious, that is left to you. That's all left to you. So we're looking at section A, case study 2021. A patient diagnosed with diabetes mellitus is having nerve damage. Is likely suffering from it's having nerve damage, and this patient is likely suffering from. The answers are so direct. Nephropathy. Nephropathy is talking about kidney nephron, right? Problems with the kidney nephron is wrong. Retinopathy, problem with the eyes is wrong. Neuropathy, diabetic foot, right? And these are all things that are common with patients that are suffering from diabetes mellitus. But now the problem is the person has nerve damage because of neuropathy, neurons, right? Neurons and nerves, the nervous system. Which of the following has been associated with an effective approach towards the prevention of diabetic retinopathy? Which of the following has been associated with an effective approach towards the prevention of diabetic retinopathy? Now, they said A, diabetic retinopathy, a person who has problems with the eyes, and the person has diabetes mellitus. Most, like 98% of every patient who has diabetes for a maximum period of more than 15 years, most of them always put on lenses and most of them always have problems with their eyes. So what are we therefore saying? We are saying that how can we help these people? We mostly help them by reducing the sugar level, improving the control of blood sugar control, so that the blood sugar level should not go up, and because they can get blind. Yes, diabetes can lead to blindness if the sugar level has continued to be skyrocketing. So what are the answers? A reduction in the serum triglyceride level, no. Improve control of blood glucose level, that's good. The use of angiotensin converting enzyme inhibitor, no. Stop smoking, no. That's not correct. So improve on, that's B, right? With the 13-year-old male sustained burn that causes cellular destruction, which ultimately resulted in vascular muscle and nerve damage. How will you classify this type of burn? Now, when you see a burn that has led to vascular damage and nerve damage, it often occur because of fourth degree burn. That is a type of fourth degree burn. We have first degree burn, second degree burn, and fourth degree burn. When such a burn occurs, it's always a fourth degree burn. Now, what has caused the burn? Mostly, such burns are always caused by chemicals and electrical appliances. Take note of that. So the answer that we have there is chemical and electric. For an example, if some of you know what raw acid is, it's a poor raw acid on your body. It takes you off completely, right? It takes you up completely. Now, the best answer, we have two answers there: chemicals and electrical and electricity, right? You can choose any of them. You can choose any of them. In that, a person who takes chemical is still right, and a person who takes electricity is still right. So there are two answers there that are correct, both chemicals and electricity, right? Now, a patient, question 4, a patient sustained an injury on the leg after a road traffic accident and is bleeding profusely. He is likely, he is most likely to suffer from which type of anemia? From which type of anemia? Hemolytic anemia occur when there is, so that's A. Pernicious anemia occur when there is improper or there's faulty production of red blood cells, right? Then iron deficiency anemia occur when there is inadequate iron in the diet, and when there's profuse bleeding. Hemorrhagic anemia is not this kind of hemorrhagic anemia. Most often at time it occur because of let's say a rupture, an internal bleed, which can also result to iron deficiency anemia also. Hemolytic anemia will come. Now, the only answer that is correct in that place is iron deficiency anemia. We have been told that a man has a genotype AA, marries a woman with a genotype AS. What percentage of their offspring is going to likely to carry the sickle cell trait? Now, you need to take note, you need to be able to draw this thing, right? They call this mapping, right? Genetic mapping. Genetic mapping. You just take A this way, AA, then AS. You map. You will notice that around 60% of the offspring is going to be AS. Right? AS means that the gene is in them, but it doesn't express itself. And these are one of the tests that are conducted even before marriage for people who marry properly, not people who get into unwholesome sexual action without taking proper proper uh, 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 proper testing to know who they are getting married to, because you can marry a sickler and then you have the genes in you, both the delivered children, all of them, they become sicklers. You start spending money in the hospital and there's not even guarantee that you can spend the money and the child comes back alive at the particular age. The child can die, so your money will be wasted. So it's 50%. Because when you do the mapping, I will just give a sketch when I'm done with this audio. I'll snap and send. And in the question 6, an AS male marries an AS woman. What percentage that for each pregnancy they will have a sickle cell trait? Yes, they will have. Therefore, they are talking about which percentage of this couple will have sickler. Now, it's going to be when you do the genetic mapping, you notice that one will have the trait that is manifesting. That is AS, right? That's SS, 25%. A 20-year-old male is rushed to the hospital and an emergency appendectomy is done due to rupture appendix. What is the most possible complication that would have arose if the surgery was not done immediately? Adhesion, no. Crohn's disease, no. Perforation has already occurred. So what can occur is peritonitis. Peritonitis is one of those muscles, those tissues those layer of tissues that cover the last layer of tissue that cover the organs in the abdomen. And so when you have ruptured appendix, it can go to these muscles, it can go to this layer of tissue and inflame it, right? Cause it to inflame. And when it's inflamed, it's a problem. It's a terrible problem. It will need so much medical attention for you to get healed from that. And it's a serious problem. You see people, they get distended abdomen and they are always feeling pain in the abdomen until they are able to even extract the fruit from their stomach. So the right answer is peritonitis. Question 8. A persistent painful emotions, irritable, irrational thoughts, impulses of images that are unable to suppress or control and that interfere with normal functioning is known as a persistent painful emotions, recurring irrational thoughts, impulses or images that are unable to suppress or control and that interfere with normal function is known as what is composure and what is composure and what is obsessive. You'll notice that the right answer to that question, composure doesn't have it has. Now, the thoughts that a person cannot control in psychology, we call that as compulsion. It's by force. It's the thoughts are coming into you, and then you are not able to control them. Then observation is far from that. Then obsessive compulsive, right? The thoughts are coming frequently, and the obsession is bringing for the painful emotions. The next answer is D, all of the above wrong. So the right answer is going to be obsessive compulsive disorder, right? Because of the painful emotions and the fact that the person cannot control his or her thoughts. When the patient starts hearing voices, it's known as what type of hallucination? Hearing voices. You don't need visual. That's A, visual. gustatory, auditory, tactile. The right answer is going to be auditory because it focuses with the eyes, with the ear, sorry. Which of the following below are criteria for psychosis? Psychosis. What is psychosis?